KNCR.
America, and welcome back. It's the Jaz McKay Radio extravaganza at 1560 AM, 97.7 FM, KNCR. Dr. Mensink from The Practice, Prepaid Family Medicine with a Difference. He's my doctor. We invite him in every once in a while to sit and chat with us.
Yeah.
What are we going to talk about today?
Well, we got several things. The first thing, imagine if you could buy a prescription of a year's prescription of what some of the major drugs. We have about 60 drugs on our list for $75
for the whole year.
For the whole year.
See, I pay a copay of $10 per drug, so wow, that'd be pretty good savings.
Yeah.
That could be a little, just about 7.5 months worth, but it's
just
the cost for 7.5 months.
Now, the other thing that's really new, and Jaz, we're just excited as everything about this. Imagine, Jaz. What we're doing is tier 2 and 3, all right? We are including now 85% of all the most basic labs for free for those patients. The blood tests.
Fantastic.
And that can save patients hundreds of dollars.
Now, let me ask you this. Now, that's a great idea. So are you going to, now, I know they're opening a PAL.
Right in our building. They're moving right PAL across right
into your building. Yeah. This, I like the system that they had set up over on the 34th Street one. That one's pretty good. I didn't care for the system when they moved from across from the San Joaquin Hospital over to where they were at currently, because it's just like you're sitting in one waiting room, and then they call your name, and you think you're going in, and then you're sitting in a second waiting room. You're waiting there. My God.
PAL is redoing their draw stations.
Are they?
Yeah. They should be open probably the end of December.
Okay. And that'll be right across the hall from you
right
guys.
Across the hall. So we're excited
will
about
you
that.
be doing draws there? Or your patients will just go over there to PAL?
Both ways. For essentially tier 2 and tier 3, we're now December 1st, tomorrow. We're going to be including essentially for most people all their labs. So about 85% of the labs we order are going to be included for free for these patients. And that can save a fortune, Jaz.
Well, yeah, not only, that saves time, too.
Yeah, and it just makes it easier. So we're encouraged about it. This is kind of a new announcement. It's we think it just adds value to the practice.
I agree. I think that's a terrific idea. It really is. It's about time. I always wondered when you were going to, in the back of my head, I'm not kidding you, I always wondered, I wonder if they're going to start doing draws and incorporate somehow with PAL.
What happens is, there's no question, the bigger you get, the more negotiating power you have. Maybe, I don't know if that's the right way to say it. You're right. We have been able, because of that, we're big enough now that we can get the prices down so that we can literally include it for free for these patients.
You do go on the right radio stations and promote yourself and see what happens.
It's working, all right? I mean, it's working. Imagine, Jaz, you could come to the office and for tier 2, and for most people, all your labs are free.
You can't beat that, no, because that's $20 usually a pop.
Yeah, more than that.
Minimum.
You know what I mean?
Well, that's what I have with my insurance is $20 a pop.
Well, we have people that it's going to literally save people money less than their copays. Literally. You know what I mean? That's awesome. So we think that's awesome.
That is very, very good.
I'll give you another one that's new at the practice, or not new, but sort of we just studied that. But Merritt Hawkins put out a study of all family practice docs and primary care doctors across the country, and the length of wait. And imagine this, Jaz. Let's say your length of wait to get an appointment. The average across the country is 18.5 days. In fact, LA, it's 20 days. All right? The worst is Boston, which is something like 92 days.
My God.
The best is Texas, by the way, around 5 days, 5 or 6 days. But here's the neat thing. Imagine you join up the practice. We have more than 80% of our patients are seen within 24 hours.
Right.
That's amazing. You don't have to wait for days and days. You can come early, get treated early so you don't get in trouble. And consequently, people don't get as sick. Yeah. And that's the advantage of joining a practice like ours, where you don't have to wait for hours and hours and days to see the doctor. This morning when I got into the office, and Monday is one of our biggest days, although today it wasn't that heavy. I saw 8 patients this morning. Average doctor sees 15 to 20. Number 2, when I got there, I had only 4 patients on the schedule. Now, 4 called in that need to be seen today, and that's no big deal, kind of thing. But that doesn't happen in most practices, and that's the I say this imagination factor of the value of the practice, because you're paying, so you have that privilege to walk in whenever you need it.
Yeah, whenever you need to, and everybody knows you, and you know everybody there, which is always nice too. You go into the practice, you know Wanda or whoever that you're dealing with. And you also you got the ID card thing. Tell everybody about that.
We started that last month, but essentially we are every patient that comes in now gets an ID card. All right, a little black and white card with the practice logo on it and a barcode. And essentially, no longer you don't have to sign in like we usually did. You just come in, walk up, put your card under the scanner,
and boom,
you're checked in, and everything is brought up.
Now that's the kind of computerized stuff for medicine that I can dig.
Yeah, well, Jaz, here's the thing: it wasn't that expensive. We're big enough now so that we can do that, for our patients. And number 2, it makes it so much easier and faster for these patients, and it's
for the staff too. I mean, it's making
easier.
it easier for the staff all the way around.
Yeah, we think the billing, the way we changed our billing system right now, it's so much easier and more simpler, so that it makes it easier.
Now you've also, because we haven't talked about this, but I want to, because you've got other doctors in the practice.
3 other doctors. 3 other doctors.
Tell me about them.
Well, we have Dr. Murphy, who does a lot of our nutritional stuff and does our nutritional classes, which will be starting up again this January. By the way, if 79% of our patients lose weight, but if you go to the nutrition classes, in addition, 98% lose weight.
Well,
that's
I can attest to this, and I haven't even tried to lose weight. But I'll give you a good example. The other day, I for whatever reason didn't want to wear my holster and didn't want to take my gun with me, so I took it out. It's an inside the pants of the waistland holster. I took that out and I put my pants. These are the jeans that have fit me a little snug over, for a couple of years now, and they're loose as hell. And I didn't notice it because normally I have that holster there with my sidearm there, and so it pulls it out a little bit. And now I'm pulling my britches up left and right yesterday. I'm walking around.
Jaz, it's interesting we talk about weight. We weren't going to talk about that, but literally, if you correct their hormones, optimize thyroid, make sure D3 deficiencies are corrected, and make sure there's no serotonin problems, literally,
it's amazing.
The vast majority of people lose weight without trying.
And it's like, that's what I was going to say. Just imagine if I tried.
I won't go there.
Just imagine if I tried.
But it's amazing, literally.
Yeah, no, it really is, and I can't. I'm going to have to get the hole puncher and punch another hole in my belt. I swear to God, folks, I'm going to have to do that. We'll be right back. More with Dr. Mensink right after this on the Jaz McKay Show. It's KNZR.
KNZR.
977 FM, 1560 AM. This is KNZR. Dr. Mensink with us this afternoon, and what is this whole deal now? Hormone therapy. You really subscribe to this hormone therapy.
Yes, I do. Right? It's part of longevity medicine, and it's a way of essentially helping the body to age better. All right, it doesn't make you live longer. All right, although there's some studies that suggest that might be so, but really, I can't tell you it makes you live longer, but makes you live better. I had a patient this morning, a male who came in who was testosterone deficient. All right, he's 54, and he was dragging, just short and simple. And he came in, and doc, he says, "I feel fantastic." All right, that's the way it's supposed to be. All right. Let me read to you. I want to talk this morning about female hormones and estrogen and progesterone. They're much more complicated than us guys, but I want to read one of the textbooks. All right. This is a textbook called the Hormone Handbook, but it was done by Terry Hertrug. And this is essentially, it's a second edition worldwide bestseller. It's a textbook for doctors. It's a case study, and I want to read it because it sort of sums it all up. Marjorie, age 46, is a strong businesswoman who is well known for her stable and dependable character, but lately her stable routine has been interrupted by her highly irregular menstrual periods. 1 month they come early, the next month late. She is also experiencing new symptoms that change from month to month. 1 month her breasts are tender, painful, and swollen, and her periods are heavy with blood clots. The next month her breasts may be fine, and her period flow is rather light. Marjorie's mood has changed. Her stable character has been replaced by mood swings. She may be depressed or anxious for no reason, and moreover, her high amounts of energy have disappeared, Now she often feels fatigued. Her looks are changing too, and her face has become pale. Her hair is thinning at the top of her skull, and small vertical wrinkles have appeared just above her lips and crow's feet at the corner of her eyes. Her annual mammogram was used to be normal, but now there's cysts found on her breasts, but luckily they were found to be benign. These are all typical symptoms of women.
This is every woman
so
in that
common.
age group.
Yeah, I saw 2 weeks ago, Jaz, a couple, all right, and it was their second marriage, all right, and they had both gone through marital dissolutions and got remarried, and we were talking about hormones, and they're in their 60s, all right, and we put them back on hormones. And the man said something very interesting. He said to me, Jaz, he said, if I had have known what I know now, and if I had have been, my wife and I had have been treated, I'd be still married to my original wife today. It's that powerful, all right? And I can't say that if you take do bioidentical hormones and they're corrected properly, you never have a divorce. That's not what I'm saying. But it makes such a major difference in people's lives.
I can see
It just, when you're talking about people who come in and say, listen, I would have got divorced if my wife and I had been on hormones and properly that. And a lot of people say, well, you would have had better sex. That's nothing to do with it.
It's not the sex, I don't think.
That's not the issue.
See, it's the ability, I think in a lot of cases, well, what's the number one cause of divorce? Arguments over financial
That's correct.
Problems. And I think that if you're all imbalanced with each other, those arguments aren't going to be as serious.
You hit the nail right on the head.
You're not going to say the things that you would say
that you're going to regret later. Yep.
Yeah, that's going to drive that she'll never forget, but that you'll never remember.
That's always the way it is, isn't it? But it is. But
that's it, right?
Yeah, that's hormones are a difficult area. I had a patient come in the other day and ask me, why aren't more doctors into this? All right, and I think there's 6 doctors in town have been trained to do bioidentical hormones. The problem that we're faced is there's a timeline of changes, so it takes for medical stuff to change. But with the Women's Health Initiative in early 2000s, the bottom line is that we found that all the hormones, Premarin, estradiol, all these things were bad, and it caused increased cancer, stroke risks, increased clots. Everything was bad, all right? And the hormones were stopped overnight. And women, by and large, not men, but mostly women, that just got, I was going to say thrown to the wolves. That's not quite the way to say it. But, we just had a lot of troubles because of this. And doctors stopped and should stop because there was a lot of issues with this. But then what a lot of people don't understand, a lot of doctors haven't clued in, and doctors are more and more catching on. But the bottom line is that these studies were redone with bioidentical hormones, the same hormones your body makes. And lo and behold, they lower the risk of stroke, cancer, egg clots. Everything is good. But there's a major problem, Jaz. Most of our education today, medical education postgraduate, residency, is run by the drug companies, all right? And what happens is no drug company can patent your own body hormones.
Right.
So they have to be compounded. So there's no drug companies pushing this to this. So that you have to go to special courses to learn about this. I learned it most through the longevity medicine A4M, where they teach these kind of things. That's the board that looks after this. But doctors have not, because of that, it's been slow progress of learning because the drug companies haven't been pushing it. And that's, to me, sad because so much good is happening with these patients.
Yeah, and I think that what you just said, I believe, is absolutely true. As somebody that's not in any way, shape, or form connected with the medical profession, but I think you're right. The drug companies are. I mean, I'm not going down the big pharma so evil.
No,
big pharma so evil
Jaz,
road, but I
don't believe that, by the way. But there is definitely a. What's happened is in this country we have big pharma plays a major role in the competitive marketplace, and it's one of the largest I would say businesses and group of businesses in the country, and they have a lot of power because of that. All right, now there's a lot of power that they could. We have the most drug companies, the most innovation, the most new drugs in the world of any other place in the world, except I believe Israel has an awful lot too. But that's good and amazing for us. But the side effect of having all that power is because it's based on an economic model. that the classic example, we use a drug called Forteo for patients with osteoporosis that have certain head fractures, and it's an amazing drug. It's a shot you give. It's the only medicine that builds bone, Jazz. Every other osteoporosis medicine lowers the rate of bone of loss of bone. Nothing else builds
Nothing
bone
builds it up?
except Forteo, and it's actually parathyroid hormone. It's a hormone shot that you give, all right? And it's expensive, all right? $2,400 a month. That's big bucks, all right?
Brother.
Now, I want to tell you something, Jazz. I can go, and I'm licensed in British Columbia, Canada, all right? I can write you a prescription for the same medicine. Here's $2,400 a month. And you can take it up to Canada, Jazz, and you can buy the same thing for $1,000 a month. What's the difference? The difference is, number one, there is no litigation risk. All right? There's $1,400 literally of litigation risk that they're buying because the litigation doesn't exist in Canada. And
now, by litigation risk, or what are you talking about?
The drug companies have to add extra dollars onto the price for lawyers in case
they get lawsuits
down the road.
Which are these commercials that we see
on TV. Have you taken this? Call 911 or whatever.
Number now. I know.
But that's what that's.
But they make it pretty. I mean, one of the things about any medication being advertised on television is so annoying. I don't care what it is, what medication is when they run through all the side effects. And the announcer's voice
would
is
I
all
take this?
Yeah. Well, the announcer's voice is all sped up. He's over there and talking so fast. They get that in though. I think that should. How does that have does that have any effect on their litigation problems?
Those I could have. Much of that is sort of cover your backside kind of stuff.
I know.
But here's the thing, Jazz. I'm old enough to have remembered practicing medicine before the Dodd-Frank bills came in, where we where essentially we are allowed to take all these advertising. But today, what's the big pharma is pitching their drugs to the common man and trying to use the common man to steer. The drug,
because then they come in and talk to you.
Yeah, and I don't know that it has
what do
had
you think
some
about
good.
Crestor, Doc? What do you think I should have, Crestor?
But it's I'm not sure that's the way it should go in the long run.
When there was also, Dodd-Frank, did that not also include was that also where the pharmaceutical firms are no longer allowed to give free samples or give you a pen?
Well,
with
it's not
their
quite
name
that.
or a pad
but
of sticky notes.
Dodd-Frank did a lot of good. There was a lot of how would I say it? Buying of doctors. That's not a real nice, popular way to say it. But a lot of free vacations or free this or free bennies and all this kind of stuff. And that stopped. And that was good. A good part of Dodd-Frank. All right, that was good. All right, and it's very regulated. A drug company, a rep comes in, and it's. You can do this, can do that. You can't do this, you can't. It's very regulated, and I think that part of Dodd-Frank was good. All right, and needed to be done. Now, there are still ways of getting around that, but by and large, it's not very easy, and those doctors get caught. So Dodd-Frank wasn't all bad, but it's a different way of looking at things today.
Yeah, things are completely different today. Let's take a phone call. We see if anybody. Oh, it's Ralph. Hey, Ralph, how are you, sir?
I'm doing fine.
What's up,
Ralph?
brother?
What can we do for you, my friend?
I have a question on thyroid.
Yes.
If you have a patient that's on thyroid medication, how often do you usually check their T3, T4s?
Let's talk about thyroid. Number one, there's three major tests that have to be done with thyroid. Number one is what's called a TSH, or thyroid stimulating hormone level. And that's a simple way to say it is it's a feedback inhibition test. So the lower it is, the better your thyroid is, all right? And that's the first test. That's fairly universal. Number two, you need to check your free T4 and T3 levels, all right? Used to be we could only do thyroid uptake, which is kind of a complex type of test. We can now exactly study the actual levels of T3 and T4 that is free. And that's probably the three major tests. I recommended this way. Number one is every 6 months to a year, you should have, first of all, every patient that comes in, we check thyroid, all right? And we do that. I didn't used to do that, but it is so common issues there that we do that as a standard. The first time you have blood work, we do that, all right? And correct it if it needs to be corrected. Now, when do you order more testing? Number one, It is no good to order the. I've had patients. Well, I need to. I'm feeling better in 2 weeks, or I'm not feeling better. I need to have the test redone. Useless, waste of time and money. It takes about 6 weeks to 3 months for the thyroid changes to sort of stabilize to where they're going to be.
Yeah. See, I've had a thyroid problem for a while, and so has my daughter. Now, my daughter goes in for a blood test every 6 months, but my doctor seems to stick with the 3 months, and I just didn't know if that was normal or
it
what.
Depends if you're having troubles, Ralph, or not.
Well, actually, I've been taking the Synthroid, I think it's called 88.
Synthroid is levothyroxine, all right? Here's the issues with levothyroxine. Levothyroxine is actually an active pro-hormone pyrrole. It does not cause any effect in the body. Don't quite mean it that way, but Synthroid or levothyroxine is actually T4. T4 is converted to T3, which causes weight loss. T3 is converted to T2, which causes weight loss. And T3, is the one that causes energy. So if you have a problem with if you take Synthroid and you have a problem converting, all right, that Synthroid or levothyroxine to T3 and then to T2, you will not get the effect, and you'll feel tired and be fat and not lose weight.
Yeah,
So what you have to either do is your doctor has to check a free T3 level and a free T4 to see if that conversion process is appropriate. Because if it's not, you won't get better. Number two, you'd either have to take a desiccated thyroid, or you'd have to take T3, which is Cytomel, essentially, which your doctor can do.
I've been going to the same doctor for quite a few years, and
but our ideas of thyroid are totally changing, and it's kind of neat what's happening. There are the other thing is that the ideas about treating thyroid today are totally different than, and some of those ideas actually exactly the opposite than we did when I went to medical school. Yeah,
mine changed just the other day with my last blood test, and I had to go from the 88. Now I'm taking the 100 starting this week.
But the bigger thing, probably about 46% in some studies of people who take levothyroxine don't respond to it. And
I was taking, they tried to get me on what's the other one? The
Cytomel or desiccated thyroids?
No, I take Synthroid, and the other one's Lisoctatril or
Cytomel. I'm not sure what. No,
I have to look at my daughter's prescriptions. But, one is the genetic, and one is the natural.
When all natural thyroids are called desiccated thyroids.
Yeah, I take the Synthroid, which is supposed to be your natural.
No, the Synthroid is levothyroxine, is a synthetic hormone. It's not natural.
Levothyroxine is what my daughter takes, I think.
Levothyroxine is the same thing as Synthroid, except a generic, but it's still a synthetic hormone.
Yeah, that's what my daughter takes.
Not a natural thing. Yeah.
But when I take it in any amount, it tends to really make me. It makes me sick. It makes my balance seem to be off.
Yeah, I would strongly encourage. Ralph, probably the most important thing I can tell you is have your doctor check the free T3 levels and free T4 to make sure there's not a conversion process. Because
he checks. He's pretty thorough on checking everything. He tells me, I can't quote it because it kind of goes in and goes out. But he tells me what it says and everything, and shows me the paper and what the ups and downs on the chart is for those areas. And I've been doing good, and I feel good.
Well, if you're feeling good, I wouldn't worry about it, my friend.
Well, the only thing is I kind of got a needle phobia, and every 3 months it bothers me.
Every 3 months? Come on. My mother was diabetic and had to shoot insulin, I think, 3 times a day for the love of Pete. Come on. Once every 3 months? Buck up, Ralph. Come on. I know you.
Well, I'm sorry, but, that's my weakness is I used to have to lay down if anybody's going to give me a shot, and especially if they held the needle or the syringe in front of me, and whatever they do, push it and have a little bit drip out.
He's going to faint.
I would faint. Yeah, or just get real warm all over.
Yeah, I wish it wasn't so, Ralph.
Well, Ralph, you take care. All right, brother.
Okay, thank you for the information.
Doc, can you stick around for a few minutes? Yeah, we'll take a break. Come right back. I see Helen's on the line. If you have a question for Dr. Mensink, 399-1560. 399-1560. Dr. Jan Mensink, The Practice. It's family medicine prepaid with a difference and a lot of improvements coming. We'll remind you of that. Dr. Mensink from The Practice. By the way, the phone number at The Practice, 871-3300, 871-3300, 871-3300. Call, go by, meet with Dr. Mensink and the gals at The Practice, get an idea of what's going on over there, and it's still $69 a month?
Still $69 a month. $69.99, $135, three tiers.
Okay, 3 tiers.
And tier 2 and 3, free labs.
Free labs with PAL, who's now going to be open in just a few weeks directly across the hall from you, across the breezeway.
Right. We think it'll be a lot easier, better for our patients.
I was in there, and I was coming to see the doc, and I said, what the hell? They got all this construction going on over there. And he says, yeah, that's where PAL is moving. I said, well, dadgum, that's convenient because...
I think in the long run, right now there's a lot of, everything's torn up.
You got to move.
But it's going to be really good for our patients.
Yeah, because, I mean, you're on one side of that parking structure or that parking lot, and they're on the other. And that means you got to move your car to go do a blood test. And I don't like moving my car. I just keep it right where it's at. Thank you very much. And so then go right across the hall and into PAL. That's a great deal for Tier 2 and Tier 3 members of The Practice. Helen is up next. Helen, welcome to the Jaz McKay Show. How you be today?
Oh, pretty good. I've been taking thyroid for over 12 years, and I keep on learning things. Sometimes you'll get the output they do for, like, this is what the drug does and all that kind of thing. And finally I learned, you have to wait to eat. And then I heard something either from a pharmacist or a nutritionist that there's some kind of thing if you eat peanut products or you eat soy too close to taking your thyroid, or if you take an antacid, that can mess up
yes, Helen.
of the thyroid.
Let's all those things you said, there's an element of truth to it. But in practice, in fact, another option, a lot of doctors tell their patients to take their thyroid on an empty stomach a half an hour before they eat. And all those things are true and good, all right? Probably the most important thing that you've said that makes the biggest difference are taking antacids with your thyroid, so far as absorption. But here's the real important factor or message I tell my patients. In fact, I tell patients, I don't care when you take it, all right? Because most of these things clinically don't make a lot of difference. And as long as you get into a habit, you take it with every breakfast or you take it half an hour before. I don't care. You do it the same way every day, and which 99% of all people do.
Most of us do that, yeah.
And there's no issues with that. We will adjust your thyroid to that. Do you follow what I'm saying? So clinically, I don't think in the long run it makes a lot of difference. Now, there are where it becomes important. If we have a patient where it's not working, all right? Let's say your thyroid isn't working and things are not going the right way, all right? Then we have to start looking at when you take it and what the absorption is. And I personally think absorption is more important, absorption issues of the stomach, in people who are having thyroid problems who are taking appropriate types of thyroid, all right? Who are not having problems with the conversion, don't have selenium deficiencies, don't have a lot of these other issues that that have a big effect with thyroid. If the thyroid is still not working and you've looked at all those things, many of these patients have really a primary absorption issue. And then the issue is not the thyroid. There's other issues that need to look at so far as your absorption and how you absorb things. But that's not that common, Helen, really. It's more of a philosophy. What you've been told and read, in essence, are all true. But in the long run, I personally don't think it makes a lot of difference. And essentially, if you do it always the same way, which 99% of people do it. They get into a routine. I take it when I get up, or I take it with my breakfast, or I take it. I don't care when you take it, but it's always the same. Usually, because once you test to that, that's where you're going to be testing to, the absorption doesn't change that much.
So the way you tell that it's working, because I can just notice subtle changes, like maybe for a few days I didn't get it, and it's like you just feel sort of weird, but it's nothing drastic. And I thought,
thyroid.
When I first started taking it, I thought, I'm going to lose weight. Well, I didn't just suddenly. It wasn't anything drastic.
It takes about 3 or 6 weeks to 3 months to work. So the way you tell it's working
is also by the testing, and if those numbers are right.
Yes. Helen, I'm a strong believer of testing for thyroid replacement. All right? I'm a very strong believer because it becomes clinically, it's easy to diagnose gross thyroid problems. A medical student can do that. But subtle changes in thyroid and thyroid replacement clinically becomes difficult to do, and is much better to be done with the testing. I'm a strong believer in that.
All right.
Yeah, so that's it. When you take it when you do your test every 6 months or a year, then you can tell if it's working. That means whatever you're doing is working.
Sure. Yeah. I mean, the other side of the coin is if everything's going well and everything's fine, why test?
Why test?
Why test
bother?
kind of thing? Why bother? But if things
unless
are
you've got
not working,
other testing going on too, other tests that you need to do, may as well just go ahead and check that box. I would guess on the form. Helen?
Well, it's not an expensive test, I don't think.
No,
it's not like cancer testing or something.
No, these are not. The thyroid testing is, these three thyroid tests we mentioned are all, ones that are included for free in tier 2 and 3, but they're not expensive.
No,
they cost probably $25 a piece. Some of them up a little bit less.
Sure.
But and it adds up. But it's not a real expensive testing. All right, Helen?
Okay. Thank you very much.
Thank you, Helen. We appreciate it. Once again, Dr. Mensink in The Practice, prepaid family medicine with a difference. Starts out $69 a month. You've got 3 tiers. And in tier 2 and tier 3, you also get all your free lab work done. And
imagine that, Jaz. To me, it's just amazing.
I know, because you're right. Because, I mean, the worst in the world is having to, to go all the way over there to PAL, and then you got to give them your insurance card. They send you your bill for the copay and all that. It's just so much better having it light. For me, it's convenient because it's right across the hall from you.
Jaz, it's I encourage people to go on the website, drmensink.com, or the practice of Jan Mensink, MD. But the website explains a lot. But we are so excited because literally it will make a major difference for many of our patients to have that extra cost. Can be we have patients go over the lab, and even at our discounted rates, $150. Oh my gosh, you know what I mean? No, wasn't expecting this kind of thing. And I look at it, if that's with our discounted rates. If these patients didn't have those discounted rates, it'd be $300-$400 often.
That's crazy.
And they just can't afford it. And I look at this as a major step to help people.
That really
major.
It is. 871-3300. Give them a call. 871-3300. The Practice. Go by, meet Dr. Mensink and all the gals that work there. And I'm sure you will sign up immediately for The Practice. I know I did. And I appreciate you coming. It's good to see you. It's been too long. We need to get you back in here more often.
Okay, thank you.
All right.
Think of the practice like a doctor from 50 years ago. No long waits for appointments. 40% of our appointments are seen same day. No rushed appointments, and access to phenomenal amount of discounts. We have the time to do good medicine. We're also focused on the emotional, the spiritual, dietary. All of those things feed in. We do more than most urgent cares do because we have the expertise, the skills, and the equipment to do it. We're able to do that top quality medicine, have that phenomenal access for less than a cup of coffee a day.
I joined the practice for a number of reasons. One, I knew Jan Mensink for many years. He's a superb doctor, and I have appreciated his expertise in other areas. It's very affordable. Medications, he's worked out deals with pharmacies. One medication I get for free would cost me $300. What I like best about the practice is the availability, accessibility. At times I'm able to get in 2 or 3 hours. They deeply care about their patients here in an extraordinary way, which is unusual in today's modern medicine in most places.
My husband and I joined the practice 3 years ago. We could not afford medical care at the time. Not long after we joined, my husband had a spider bite and he got very ill within a day. I was terrified that we were going to have to put him in the hospital, which I knew we're looking at $40,000, $50,000. We brought him in and Dr. Mensink saved his life. We were able to come in here every day without any extra charges. I love Dr. Mensink. He's wonderful, and I will never ever forget how Dr. Mensink was with us.
My family and I have been members of the practice for the past 2 years. I joined the practice because I wanted to find a place where my family could be treated without taking a lot of time. But what we like about the practice is that if our kids are sick or we're sick, we need medical attention, they'll take us usually the same day. They treat you very well. It's not very expensive. It's affordable. I like that the practice is always there for us. Nos unimos con The Practice para que nuestra familia tenga muy buenos, eficaces doctores. Nos gusta mucho porque si uno de mis hijos está enfermo, nos meten de forma inmediata, por lo general el mismo día.
Lo que más me gusta de Practice es que hablan mi idioma.
Es un plan muy económico y que atienden a uno muy bien. Lo que más me gusta de The Practice es que siempre están ahí para mi familia.
Cuando llegué a la oficina y vi al doctor Mensink, yo llegué y me sentía débil, muy débil. Yo había visto muchos doctores y no me arreglaban el problema. Pero cuando llegué aquí al doctor Mensink, él me hizo un chequeo, un examen completo y encontró el problema y me ayudó, me dio el tratamiento que necesitaba y ahora me siento con mucha energía y estoy muy contento aquí. Él es un excelente doctor, estoy seguro que les dará ayuda tal como lo hizo conmigo.
Think of the practice like a doctor from 50 years ago. No long waits for appointments. 40% of our appointments are seen same day. No rushed appointments, and access to phenomenal amount of discounts. We have the time to do good medicine. We're also focused on the emotional, the spiritual, dietary. All of those things feed in. We do more than most urgent cares do because we have the expertise, the skills, and the equipment to do it. We're able to do that top quality medicine, have that phenomenal access for less than a cup of coffee a day.
I joined the practice for a number of reasons. One, I knew Jaz Mensink for many years. He's a superb doctor, and I have appreciated his expertise in other areas. It's very affordable. Medications, he's worked out deals with pharmacies. One medication I get for free would cost me $300. What I like best about the practice is the availability, accessibility. At times I'm able to get in 2 or 3 hours. They deeply care about their patients here in an extraordinary way, which is unusual in today's modern medicine in most places.
My husband and I joined the practice 3 years ago. We could not afford medical care at the time. Not long after we joined, my husband had a spider bite and he got very ill within a day. I was terrified that we were gonna have to put him in the hospital, which I knew we're looking at $40,000, $50,000. We brought him in and Dr. Mensink saved his life. We were able to come in here every day without any extra charges. I love Dr. Mensink. He's wonderful, and I will never ever forget how Dr. Mensink was with us.
My family and I have been members of the practice for the past 2 years. I joined the practice because I wanted to find a place where my family could be treated without taking a lot of time. But what we like about the practice is that if our kids are sick or we're sick, we need medical attention, they'll take us usually the same day. They treat you very well. It's not very expensive, it's affordable. I like that the practice is always there for us. Nos unimos con The Practice para que nuestra familia tenga muy buenos, eficaces doctores. Nos gusta mucho porque si uno de mis hijos está enfermo, nos meten de forma inmediata, por lo general el mismo día.
Lo que más me gusta de Practice es que hablan mi idioma.
Es un plan muy económico y que atienden a uno muy bien. Lo que más me gusta de The Practice es que siempre están ahí para mi familia.
Cuando llegué a la oficina y vi al doctor Mensink, yo llegué y me sentía débil, muy débil. Yo había visto muchos doctores y no me arreglaban el problema. Pero cuando llegué aquí al doctor Mensink, él me hizo un chequeo, un examen completo y encontró el problema y me ayudó, me dio el tratamiento que necesitaba y ahora me siento con mucha energía y estoy muy contento aquí. Él es un excelente doctor, estoy seguro que les dará ayuda tal como lo hizo conmigo.